Why is it important to get HIV-positive babies on HIV medication? Because we know it decreases their chance of dying by 75%. In Africa, though HIV patients have access to free HIV medications and programs, too many young children are getting lost in a system that is broken. Using Kenya as our example, let's take a look at how the current system is supposed to work. When a pregnant woman comes to a clinic or hospital to have her baby, she is tested for HIV. If she is found to be HIV positive, she is told to return 4 to 6 weeks later so her infant can also be tested for HIV. If mother and baby do return, a blood sample is taken from the infant and is sent to a lab in another part of the country to test for HIV/AIDS. Ideally, results of that test are returned back to the clinic within a few weeks, and if positive, the baby is placed on antiretroviral medication. If negative, it's good news, but the baby must still return for a second and third HIV test at 9 and 18 months in case HIV is spread to the baby due to breastfeeding. Sounds good, right? Let's take a closer look. Let's pretend that these 100 dots represent all children in sub-Saharan Africa who are HIV exposed, in this case born to HIV-positive mothers. In reality, there's a huge gap in the current system, as 60% of these babies never return for HIV testing at 6 weeks. Why? Sometimes it's due to poverty, unforeseen barriers at the hospital, or fear due to the stigma of being HIV positive. There are many reasons. If the mother does return to have her baby tested, many blood samples are lost between the hospital and the lab, and since communication is only one way, the lab may never know if a blood sample was sent in the first place. This results in even more children falling through the gaps. To make matters worse, many hospitals do not receive the test results due to communication challenges between the lab and the hospital, creating yet a third gap in the process. Meanwhile, the mother, who is told to return every 30 days for test results, becomes deeply concerned. With no results and no ability to track the blood sample at the clinic, the mother, who most likely earns less than $1 per day, often grows weary of the process, gives up on the child, and puts what little resources she has into her other children. As soon as the child gets sick, it is often assumed that he or she has AIDS, and over time, due to lack of care, the child, who may or may not be HIV positive, dies, creating yet another gap. For this reason, it is just as important for a mother to know her child has tested negative instead of positive. Up to this point, 85% of these babies have fallen through the many gaps currently in the system. In the event the mother does receive the news that her child is HIV positive, there is often a lack of infrastructure at the hospital to even start her baby on HIV medications. Because of this, roughly only 10 to 15% of these remaining babies are ever put on HIV medication. After the entire process, only 2 out of these 100 babies actually receive care, life-saving care. Here's the bottom line. Lost or missing test equals loss of life. No communication with the mother equals loss of life. Not starting an HIV-positive baby on medication equals loss of life. Now for some good news. Global Health Innovations has developed a solution. We call it the HITSystem, a new high-tech infrastructure designed to streamline the process of testing HIV-exposed babies for HIV/AIDS. The HITSystem provides tracking, communications, and accountability between families, clinics, and labs, and most importantly, facilitates the initiation of HIV medication if a child is positive. Here's how it works. When a pregnant mother comes to the clinic, she is tested for HIV. Her status is recorded, and if she is positive, her new baby is enrolled into the HITSystem, where he or she will be tracked from that point throughout his or her care. If at 6 weeks of age the mother has not returned the infant for HIV testing, the HITSystem automatically alerts the hospital to contact the mother, either by cell phone, instant messaging, or physical contact, to bring the child in for testing. Unlike the current system, we will not lose track of this child. Once a sample is taken for testing, the HITSystem tracks the sample from hospital to laboratory and then back to the hospital with the results. The HITSystem requires that each sequential step involved be entered into the system by a trained staff member to ensure the intervention has taken place within the needed time frame. The HITSystem is automated between the lab and clinic to eliminate the possibility of results being lost and to ensure that all babies' test results are delivered in real time. Now, clinic personnel can contact the mother with results in just days instead of months. The mother, now knowing for sure that test results are waiting for her at the clinic, returns immediately. If the infant is HIV positive, the mother will be counseled and her infant will be promptly started on HIV medication and can still look forward to a long, healthy life. If negative, the relieved mother and child returns to a normal life and is contacted again at 9 and 18 months to return for follow-up testing. The HITSystem provides the infrastructure and tracking mechanism to successfully treat mothers and children so heavily impacted by HIV/AIDS. But it's more than just words scratched out on paper. More than just a concept. More than just another idea.